Great, thank you, Rachel. Good morning, everyone, and welcome to the morning plenary on clinical applications of artificial intelligence. So, with that, I just want to say a few things to start out. We'll maybe have a little fun with this. We've had a lot of innovation in society, as long as we've all been around. And now we're at another point with something really exciting happening. But for those of us that have been practicing, for 30, 35 years, do we remember having similar discussions about what is the internet going to do to our industry? Email? Oh my gosh, we have to use email? Jerry, do you still have your AOL account? She does too, yeah. I don't think you can get rid of it because the AOL is gone and there's no way to turn it off now. No, I remember when we started the clinic and we were saying, we got to stop calling each other, we all have to get email addresses. And people were like, what? All right. You can say the same thing. Remember when the fax machine came out? I think some of us still have to use a fax machine, unfortunately. But anyways, it moved on. We've had discussions about the electronic health record. There's a lot of business software coming out now. I think it was 4 years ago we talked about large data, machine learning, and now we have AI. So with that, I will turn it over to Lori Watanabe, who is the editor, as you know, of Mobility Management. And here we go.
Thanks, Mark and Rachel, both tall people, so we will just lower that. There we go. All right, thank you, and welcome to our morning plenary, Applications of Artificial Intelligence in the Complex Rehab Technology Industry. I'm just going to start by introducing everyone, and they're sitting kind of far away from me, which makes me think maybe I was a little too terrifying with my emails or something, but if you could just wave or smile or give a shout out or when your name is called so everybody knows who you are. David Gelbard is the founder and CEO at Parachute Health in New York. Elegast Monbaliu, I'm so sorry, is a physiotherapist and professor at KU Leuven campus Bruges in Belgium, as well as chief clinical officer at CoMovit. Is it CoMovit? Yep. Andi Saptono is the assistant professor in the Department of Health Information Management at the University of Pittsburgh. Speanburg is a research associate in the Department of Physical Medicine and Rehabilitation at the University of Pittsburgh. And Stephen Sprigle is Professor George W. Bioengineering, Industrial Design, Mechanical Engineering at the Georgia Institute of Technology in Atlanta. So, as we know, the idea of artificial intelligence, or AI, the idea that machines can become intelligent and can learn and make decisions the way humans do, that's not a new concept. It's actually been around for hundreds of years, although AI, as we commonly think of it today, has been around for about 75 years. So today, I think it's easy to feel like we're in our Brave New World stage with AI, that it's capable of accelerating human progress in ways that we maybe could not have imagined before. But there are also concerns of AI also running rampant and unchecked, and robot overlords, and blurring the lines between what is real and what is not, and making it hard to discern what's real and what's not, and actually hindering our efforts instead of helping them. So while we often hear of AI in mainstream terms, such as ChatGPT, today we'll be focusing on AI as it's currently being used in seating and wheeled mobility. And we'll talk about how and when AI could also be used in CRT in the future based on what we know and what we're seeing today. So, housekeeping item, we have set up a Q&A time toward the end of the hour, but if you have questions during this main panel discussion, we're happy to address those as those come up. There are microphones in the main aisles here. And our panelists were chosen because they have incorporated AI into their seating and wheeled mobility work. So I'm going to start off by asking each of them to briefly describe how they're using AI today. And now the English major has to find the slide thing. All right, so I'm going to ask each one of our panelists how they are using AI today, and let us hope I can do this. Nothing's happening. Is it not advancing? I'm already in trouble. Thank you, whoever did that. Magic, human, AI, thank you. So I'm going to say whoever that was, thank you so much. And I can barely see over. Okay. So David, let's start with you. Can you tell us how you are using AI? It says in my notes to facilitate business processes and CRT provision.
Yeah, nice to see everyone. Nice to meet everyone. So Parachute Health, what we do is there's two places mainly where AI has been applicable for us, at least immediately. One is that when you're ordering a power wheelchair, the clinical documentation required to get through a stringent payer process from approval is incredibly laborious, takes a lot of time, and there's a lot of data that ultimately needs to match up against what the payer wants. But the two systems, the EMR that has the clinical data, the payer that has all of the authorization criteria, they don't often match. So there's really two applications. One is on the DME provider side, when the faxes come over from the EMR. How do you use AI to read that data quickly, structure it, and then quickly check against the payer guidelines? The same ultimately becomes true on the EMR side, where if you're able to just do it at the point of prescribing, then it truly accelerates this process of understanding the insurance process and provides more time to be with patients. And yeah, I think the second aspect is if you could use AI to streamline the administrative part of the process, then it does enable time to be more with patients. And so one of the things we're actually strategically working on with UPMC down the block is a collaborative handoff process where it's not just the clinician, it's not just the provider of care, it's not just it's everyone working together to support patients. So if you could use AI to streamline the administrative part of the process, then how do you create more of a collaborative care around that patient in a workflow? So when they go from an Epic facility to a Brightree DME provider, they're able to collaborate around the patient. So AI enables us to get rid of the stuff that's monotonous, the paperwork, and then enable us to do more around the patient and care providing, and that's ultimately what we're focused on.
Okay, great, thank you. Next, I think I got my slides mixed up, so I'm just gonna catch up to where, whoops. Elegast, is that correct?
That's correct.
Okay, so Elegast, can you tell us how you're using AI?
So in the field of neurorehabilitation, I'm sitting here, by the way, with two hats on. I'm on the one hand working in the field of research, and on the other hand, I'm also involved in the company Comovit. But AI and neurorehabilitation is really, it's going fast right now, in all aspects of seating, mobility, but also measurement assessment. And the key there is to make sure in the fact that it's going that fast, that it also should act fast. So if you go to the next slide, what we do in our research, so yeah, this one, what we do in our research is on the right side on the slide, you can see that we use automated machine learning for assessment. Why is that important? Because in the diagnosis making, for example, of complex movement disorders, dystonia, choreoathetosis, spasticity, it's really important to have it right. So you need a lot of data there also in that machine learning to make the right diagnosis. So for that aspect, we use AI and implementing again in our research to make sure that we compare this with other non-AI assessments to make sure you can feed that. That's the one hand. On the other hand, we use smart algorithms in Comovit. So Comovit Smart is a wheelchair that is using smart algorithms to make sure for people with complex movements, again, because that's the field where I'm working in, people with complex movement disorders, that they normally with normal joystick, traditional joysticks, that they cannot drive, but they have the abilities to drive with some basal head control. But the problem is that basal head control and basal foot control, that they still have some involuntary movements. So what we do in here, and I will make the comparison with a car, if you drive your car with, you push your pedal and to accelerate, and you push that forward, you use force and you use range of motion. But if you do that in a scattered way, your car will drive in a scattered way. What we will do with our smart algorithms in our steering system, we filter that out and translate that into smooth movements. So that's what we do with the smart algorithms.
Okay, thank you. We are just, obviously, I am not good at this. Okay. Cass, I'm going to ask you to tell us a little bit about how you're using AI as a research tool, please.
Sure. So in our applications, we use AI in clinical settings within a hospital. We teach patients the uses of AI voice assistants and environmental controls, including lighting, TV controls, and voice-activated nurse call bells. And we use this to determine whether or not AI voice assistants can affect inpatient hospital stays, as well as outpatient PT, OT, and other applications. So determining whether or not the AI can be beneficial or detrimental to their overall care.
Thanks. And Andy, I'd like to ask you how you're using currently AI for ambient listening for documentation.
Thank you, Lori. So I'm glad that I am placed after the need for documentation and the way that we conduct assessment, as well as the voice access, because all those three are combined in this ambient listening, where an AI is listening to the conversation during the clinic and assisting in the transcribing their conversations into text. That's from the audio side, and then reformatting the text into clinical documentation that is meaningful and can be enriched by other clinical information as well. So not only that it's just the conversation, but we can also link to the person's medical history, to the coverage, to the tools, to the reference on why we need to prescribe a certain assistive technology for that client, which hopefully can cut that clinical documentation cost and address the clinician burnout.
Oops, oh my gosh. Please don't leave just because I put that up by mistake. I'm trying to find Steve's slide. Well, I went through the entire presentation, Steve,
go
to
back.
find you. Back one?
Yeah.
No.
Oh.
Cass can go again.
There we go. Okay. Steve, believe it or not, AI for product development and evaluation. Can you give us a quick
Yeah, so
summary?
it's kind of interesting. You've heard, the vast array of applications, and ours is on evaluation and development, sort of in product. We're doing three kind of disparate things, but they're kind of all related. One is, looking a little bit about using AI to evaluate customer reviews as a way to sort of facilitate an understanding. And we're not focused on CRT at all. We're focused on products that have hundreds and hundreds of options. And that allows you to sort of tease out the good and bad and the ugly. When a clinician's faced with trying to pick something out with so many options, how do you sort of, get that information to your client? And we have found ways to generate some good tidbits, and some of it has to do with how you interact with the large language models. It's a trick, and everybody here probably knows that, certainly, those who are doing with listening or access technologies. The other thing we're looking at is sort of how you might individualize functions or operations in a technology. So if you go out in the exhibit hall, you'll see so many new technologies that have sensors. They're measuring something, they're collecting something. And this gives us the opportunity or the potential to learn what's best for people. And then if you know what's best for people, you individualize that operation accordingly. So first up for us is sort of trying to look at machine learning and AI to improve digital stimulation. And this came from a book I read called Everyone Poops, which it's a must read, I believe. It's just sort of starting, so we really we need to find some resources. So if anybody out there is independently wealthy, I'm looking at you, Schmaler. That would help. But the third thing we're doing is sort of AI design tools and techniques to help improve low volume development. And we started this by interviewing a lot of AT inventors and developers that, start very, in their house or in their garage or something. And, can we use AI design tools to make it easier for them? That's a hard nut to crack, and I'm sure you've run into some of those folks. And there's emerging tools that are accessible to people that they can mainly use. It's not really as easy as it sounds. Everybody's sort of learned that, well, you can just sort of ask, Llama to design you something. So we investigated this. We hold a patent on a cushion, and so we put in all our patent claims and asked the engine to design it. And this is what you get. Lori, go.
Yeah, good luck with that, right? Good luck with me and my slides today.
So that whole joke is gone.
No,
But it was an exceedingly
it was not
funny
him.
joke.
It's me. It's
And,
operator error. It's
Yeah.
there we go.
So this cushion is in booth 00 in the exhibit hall. Swing on by. Yeah. So this is actually what it came up with. If you really look at it, it's great.
Thanks, Steve.
Yeah.
So I'm gonna start diving a little bit more deeply into some of the questions now, based on what our panelists said that how they're using AI currently. And I wanted to start with Cass. Cass, have you gotten any pushback for using AI? And if so, how have you responded to people who are kind of worried or doubtful about using AI?
Right. So in our position, we use AI voice assistants most frequently, and there is a lot of pushback, especially when introducing the idea to patients, especially in older adults, ages 65 and up. There's a lot of suspicion behind what their voice commands are going to be used for, what conversations are going to be saved, what's listening to them. And a lot of what we have to do is listen to the participants and try to dispel any rumors and reassure them that the AI is for their benefit and not to control them or to collect information that they don't want collected. So it's explaining that AI is not a tool to simply collect information, that the AI is only listening when asked to listen, and only doing things that it is specifically asked to do. Part of our research is also collecting the commands that the participants use day to day, and giving them an option that their information is or is not saved has been helpful. While collecting the voice commands is great for us, our statistics, and learning what is or is not valuable, giving them an out and a way to avoid having all of this information collected is beneficial for us, and explaining to the participants that it's an option. It's not something that is going to be rooted in their life forever, and it's up to them whether or not the AI is used at all. And I think that is what has been most helpful, is listening and explaining.
Okay, thank you.
Thank you.
Andy brought this next question up while we were talking about what topics we should cover. So Andy, what ethical issues do we need to consider and keep in mind when using AI?
Thank you, Lori. So when we work with an individual with this, when we work with assistive technology, we work with individual with disability, right? When I'm thinking about the ethical issues, I ask the expert as well, which is the AI. So I asked ChatGPT, what are the top 5 highlights in the ethical issues for AI? So I think Cass has touched a very important part, and that's actually number 4 in what ChatGPT said, which is the autonomy and control. That's one ethical issue. Ultimately, we want the human to be in control, not the AI. Even though when the AI can make decisions, we need to be able to give the control, the autonomy to the human, because that's going to be one key point that everybody will ask. There is a bias. The data set that we use to train any AI model can be biased, can be geared toward a specific populations, which reduce the accuracy in other populations. For example, a lot of the large language model right now is trained on the general internet documents. And there are a lot of toxicity, ableism, all those language being used in the internet, right? If we're not careful, those kind of things can seep into the use of those generative AI as well, which again, it's ethically incorrect when used in let's say, in a more vulnerable population. So that's the bias that we need to control. And then privacy and surveillance, that's another concern. Mark, a long time ago, said that, hey, if you only de-identify the zip code from 5 to 3 numbers, if the person have a very specific assistive technology, I can still tell who that person is. And that's just using a human brain with that small amount of information. AI can use a huge amount of information and they can connect more dots, which means that a lot of the privacy and security concern is something that we have to discuss as well when we are thinking about adopting the use of artificial intelligence. And lastly, it's about the transparency and accountability. A lot of this model, as Steve said, are complex, and we use trick to get the result out of that model. But we don't really know what's happening inside that model itself, which means that if there is something wrong, then the question becomes what happens, where it is going wrong, and who are accountable to that. I attended Kendra Bett's session yesterday, and she talked about the just culture, a culture where we learn and we identify an error or a mistake with the purpose of improving it, right? This is something that we have to also incorporate when we're talking about the transparency and accountability in AI, because not a single person can be deemed as accountable. It is going to be an entire system. It is going to be an effort, a village effort to improve this and adopt it into our flow. So, and then the fifth one, the last one, is the environmental concern. ChatGPT seems great, but every, I would say, 10 lines that we ask ChatGPT, we consume 1 bottle of water to cool the system because of how hot it is. The heat that it produces is very, very huge and gigantic to be able to respond to those inquiry. So as a steward of this planet, that's also something that we need to be concerned of, the environmental impact of this AI. So.
Thank you, Andy. Stephen, you've been using AI in product development. Have you been working with CRT manufacturers along the way, or would you like to more robustly work with manufacturers in this capacity?
So what we're investigating is sort of how to facilitate this design, right? And there's a lot of things that AI can help on, especially when you're dealing with low volume and small markets, right? The large language models are not trained on assistive technology, and that's pretty evident. This is kind of a weird field. There's a lot of uniqueness and oddities and insanity associated with it, and so they're not trained well. I think one of the values for the CRT companies, especially the large resource companies, is still, how do we train these models to really tease out target user groups, especially ones that are functionally diverse but might share a technology need. And that's going to require us probably to train a GPT or large language model on information that's not available on the wider internet. Well, think about it. You know, why couldn't we upload, what year is this conference? Like the 50th year?
39.
39.
No, that's right. I was kidding. You know, train it on 39 years of International Seating Symposium stuff. Train it on longer than that. It probably has been 50 years on RESNA stuff. That's not available to the internet, but it can help even the big companies start to tease this out and figure out the target market so they, I think, design accordingly. You know, when you have a small market, design for small market. And with rapid, you know, manufacturing, I think it's better than always going to a high volume market because that breeds cost and that breeds disparity.
Okay, thank you. Elegast, what have you learned as you've incorporated AI into your work processes?
So if you can give me the slide, please.
Oh, here we go.
So I've summed them up. So if you go to the learning, a little bit further, another one. Yes. So using AI in our assessments, but also using smart algorithms in our powered wheelchairs. So we know in general AI it's a growing field in neurorehabilitation in general, but there are some pitfalls. Of course, it's coming anyway, but we should embrace it. That's the first take-home message based on our experience in our university, in the assessment, but also in the developing the smart algorithms. But still, AI is an intriguing tool to apply, and actually it is used to augment, and that's what was my other slide I was also mentioning. It's used to augment, but it's also helpful to fasten up some things. And fasten up some things, for example, in assessment, in training. But then, of course, if you talk about training and assessment, you should understand it well. And the feeding, the data used for that is really important. So the database where it's coming from should be reliable, sensitive, good enough, representative. So this is really, really important to make sure that the way how it's fed to the algorithms, that it's data that is representative. So based on that, of course, it's really important that you collaborate. So that's another thing. Collaborating to make sure that you have that data coming from the different angles, that it's representative again. Another thing is of course, is use it with caution, because of course it is still a kind of mathematical, statistical thing, and they can be mistakes. That's how it is. But again, with my clinical background, using assessment, also automated assessment of these complex movement disorders, when we go to the field and say, okay, help us with collecting data and to make sure that we can feed this algorithm, then hold on, these caregivers, these therapists say, oh, I'm afraid of AI, this will take away my job. Well, of course, it's not. We know that AI will not take away the job, but we know it will not replace caregivers. But what we do know for sure is that caregivers using AI will replace the caregivers who are not using AI. That is something for sure. And another thing is, and that's certainly also with the smart algorithms in our wheelchair, is the following, is regulation. Regulation is something that it's a dilemma, I'm gonna be honest. It's a dilemma between, on the one hand, control, and at the same time, you can kill it. It's stifling it. So it's finding there the balance, the responsibility, the accountability, but also the freedom to use it. So if you have, for example, developed algorithms, if you develop AI, if you see much more beyond the next steps, but at the same time you see regulation that is kind of blocking it, it's a challenge, and it's a challenge that you definitely should make sure that we collaborate with government, collaborate with industrial partners, collaborate with all stakeholders involved, also the people with lived experience, to make sure that we have indeed all these stakeholders, kind of a quadruped helix model, have them all involved to make sure that we use it in the right way, right place, right time, and with the full-blown possibilities that AI can give us to the field of complex movement disorders and powered wheelchairs.
Okay, thank you. David, next question. Where and how else in CRT do you think AI could potentially be used based on how you've been using it so far?
Sounds good. I'll ask for the slide too. If
Oh,
possible.
okay.
Well, maybe I'll step back. So I started Parachute about 10 years ago. My dad had left the hospital after a life-saving surgery, and they sent for a walker, and they sent for home care. The home care came, but a basic walker didn't, and it led to a fall. So, I think I'm sitting at, what do we do to try and change it? What we did was basically say, I called the hospital. They said, oh yeah, we faxed it. We faxed it to this vendor. Called the vendor. The vendor said, oh, I didn't have the data needed, so we couldn't provide the service. So over the last 10 years, we've tried to solve that problem, which is we have about 240,000 docs across, or MPIs across the US, 6,000 facilities, solving this problem of the data comes from the EMR, it gets sent to the providers of care, they then have to check against this insurance regulation, and it's a back and forth, So the question is, how do you ultimately try and streamline that process? So that's what we've been working on for the last 10 years, but power CRT, this industry has largely been not solved for, even over that 10-year period. And as now we're bringing insurance companies into the mix, because at the end of the day, I went to Starbucks this morning, I used my credit card. There wasn't this question if I had to come back 2 weeks later to see if I had to pay. They didn't, say, oh, we're going to bill you for 100 and maybe we'll get a one. I mean, it was a very transparent, clear process at that point of service. And so as we start learning with the payers, how do you create the same dynamic, an auto authorization, which seems almost like not possible, right? Based off of at least probably people in this room. It might be true with a coffee, it might be true with a basic walker that impacted my dad. But with a 20 to 40,000, with a very expensive product, we already know that it's going to be a conversation with the payer. It's a manual review. So the question is, how does AI kind of help that process? And it really is the same construct of how do you create a streamlined ordering experience, right? You have this data in the EMR, all these documents, it has to get sent to the provider of care. They're going back and forth, back and forth. That's where AI could, of course, be helpful, is in at least satisfying those technical requirements. That doesn't mean that this industry will ever get an automated approval. Everyone gets a chair, right? It's not going to happen. But you also, you may or may not want that to happen, because on the insurance side, they're going to prioritize that patient differently. So instead of just looking at it as a cost, they'll look at it, hopefully, where I'm pushing, is a patient that needs more care, more thoughtfulness. A person on the other line, not just a written approval or a written rejection. And I think that level of trust in our healthcare system needs to come back. And it starts with conversations across the different actors where, yeah, the data in the EMR came over, they sent the data up, that then drove this manual review. The manual review today is this big function around, am I going to get paid? But if that process becomes more of a conversational approach where the technical requirements, those are satisfied. Now it's a question around clinical review. It upgrades healthcare. It upgrades the process of how all the different actors look and surround a patient. So to me, that's the last 10 years of Parachute has been just trying to streamline what can be streamlined. Walkers, wheelchairs, hospital beds. But now if you get into the more complex products, that's the next opportunity, I think, especially in CRT, is, when we started, we would go to the facility and say, oh, why don't you want to use this for CRT? Oh, you have to take 30 pages of documentation and then put it in our system. Doesn't work. too complicated. There's too much information. But now if there's a way of streamlining that process, either through just purely communication or through AI now, there's a way of reading the documentation and then figuring out in a more, I'd say, accelerated way how to understand whether that product's going to be approved. And where the conversation is needed, open up the conversation faster, now with all this administrative cost and time. So that's the main application for how we're thinking about it as we enter the CRT space with certain certain chairs we already have on the system. But I think the more and more patients we could help, the better. That's kind of the ethos. So yeah, that's what we're solving through business process.
Okay, thank you, David. We wanted to give a lot of time for questions, so if you have any questions, there are microphones up in the main aisles, the ones closest to the front. Any questions for our panelists? Otherwise, I have questions for our panelists. Oh, okay.
I'm really uncertain as to whether you're going to.
Can you get closer
Okay.
to the mic?
Okay.
Sorry.
With everything interconnected, I'm not sure how you're going to get regulation. If you regulate here, it's going to be like whack-a-mole. It's just going to pop up someplace else. Don't you? I mean, it looks to me like it's just going to be the wild, wild west. How are we going to regulate?
Are you talking about name, image, and likeness for the NCAA or something else? Go ahead. It's y'all's account.
I think that is the biggest challenge, in my opinion, because we have so much opportunities, possibilities with AI, but finding that balance with collecting data, privacy, we have in Europe GDPR, but also the fact that indeed you have access to this data, use of data, privacy is also part of it. So it's a huge ethical question, so that's the biggest challenge. And that's the reason why we really should collaborate, because it's in that brain share to make sure that you find each other. Will it be easy? No. Should we accept the challenge? I think so. There's no other way.
The follow-up was, is there any attempt to bring this to the United Nations? Because I don't think that there will be any success unless that happens.
If I was to think about it as a software company, and also as someone who uses ChatGPT probably too much at this point, I had that initial concern around how much information do I put in, and is this going to be served up to everyone else? And I think the challenge from a software side is if you open up all of someone's personal information to everyone else, then a lot of people aren't going to use the product because they won't trust that it'll stay within their own ecosystem. So I think there'll probably be ultimately market forces where if a lot of people stop using a product, they know, oh, this one will give your data to everywhere else, then they'll just go to the next AI vendor. And there's so many that coming out now, right? There's obviously ChatGPT, there's Gemini, there's a lot of different ones. But I think the thing that's hard to ignore is the speed and the productivity increase. Even like in day-to-day, I'm going to Pittsburgh, what are the good restaurants in town? And okay, well, at that restaurant, what should I eat? You just rapidly go through in a way that's so much faster than a Google search. So much faster, it's in seconds. Or, hey, what are my 2025 resolutions? The more it knows you, the more effective it becomes. But there's got to be this trust factor around, is it going to be your data? And right now, I don't see a regulatory but I think the market will ultimately decide on how much data is right, and the market people will ultimately respond with, is it my data, or are you going to share my personal details with everyone else? And I think that should put things in check naturally. But I agree, there's got to be something that gets regulated.
Okay, thank you. Next question, thank you.
So I'm a therapist in a seating clinic, and we are noticing more and more odd kickbacks from insurance of this particular code is being denied, et cetera, and it's becoming more apparent that AI is being used to read our documentation. And so it's actually created more of an administrative burden for us because we're getting more and more, I have to write an appeal for something that if a real human read this, it would make sense. I'm curious what your suggestions are in this odd transition space where right now it feels like AI is creating more of an issue for us as far as documentation and paperwork as we're responding to asinine requests. For lack of a better term.
Yeah.
Have you entered the asinine request into a large language model and asked to refute it?
Absolutely.
Yeah. Did you like the response? Was it helpful to you? Did it calm your nerves?
It gave me a space to edit from.
Okay.
And so I'll frequently use a chat GPT to be like, hey, can you outline the LCDs for blah, blah, blah. And it gets me like 60 to 70% of the way there. It definitely saves time in the response, yeah.
Good, good. Yeah, welcome to college, because that's exactly what college students do, by the way. Except I think they're at 99.9%.
Yeah.
And
yeah. It would have been really nice.
yeah, they don't even review it. That's what kills me, is they don't. That's a whole nother beer conversation.
I think that's like the nature of how ridiculous this will wind up becoming, because, you know, of course the insurance companies are deploying these AI bots to quickly deny. Before that, for the AI bots, they were sending it offshore and, you know, paying racks and other to deny if a technical thing was missing. So this is just like the next version of that. And, you know, at least what we're seeing is an insurance company deploys a bot that says, hey, this doesn't work for this reason. Then you send back another bot-generated response. Like, it loses the picture. It loses the fact that there's actually just a patient that needs care, and that everyone's spending all this time, money, resource on administrative back and forth, when if that was streamlined, there actually would be the savings for the payer, and they wouldn't have to be denying or pushing back or questioning. Now, I'm not saying that their role of questioning care isn't legitimate. That is legitimate, and that is valid. They can do that, because it's ultimately, you know, their member. But the amount of time and resource being spent on that on both sides. So now you get an AI bot, talk to their AI bot, and who ultimately decides? And I think that's ultimately what we're trying to think through is, all right, CRT is definitely in that unique 2% that's almost always manually reviewed. Okay, fine. So then how do you set up a more direct dialogue where at least the cost of getting that data to them, it could accelerate to a clinical person faster to actually get to a result and review? That's not going to be a today, you know, that's not a tomorrow solution, but it is directionally where I do see things moving. This interim period where it's bot to bot talking, I think asinine was the right word. But I think there's going to be a jump point in that, and there's also a lot of commentary and questions across the country on prior authorization and things like, how do you make this process faster? So yeah, I think it's not a problem that's solved today, but I know that it's a problem that is being currently looked at. We're looking at it with a lot of the payers.
Yes, thank you.
I have a question. I'm not sure for the panel, if not just for the clinicians in the room. If you're a clinician, and in my previous life I had a private practice, I was in the community running around from one client's home to the next, you know, with my phone in my hand and my charts and all of that. So how do we, as that everyday clinician, take AI and use it to our benefit beyond documentation? So it's a question maybe if somebody else has some suggestions of how they're just using it just to get through their day. That's what I'd be interested in from a practical perspective.
Does anybody have any suggestions or examples? I see people moving.
If
One second.
nobody takes it, I'll take it.
She's coming, the aisle.
So to answer that question, one of the things that clinicians have been starting to do is actually start to make your own ecosystem of what you do in response to your treatments and to the patients that you're working with, specific to whatever your niche is. So I can actually start to take all the treatments and use all the documentation I'm already using to then create a ecosystem that where if I have asynchronously, if I have clients who are asking questions, it can actually answer the question before I even get there. So I think that's a really good way outside of documentation that AI can be used in a way that reduces time, and also I've fed everything into it, so I already know that it's verified. It's verified by me, and everything, all the ethics and all the brains that I put into that.
Thank you.
Can you explain what you mean by I put everything into it? What's it?
Sure. So currently working on, I don't know the actual terminology, but basically in ChatGPT Pro or Plus, whichever one it is, you can take all the courses that I've made, all the Zoom calls that I've had and recorded with patients, and I can then take in any kind of educational handouts, all of that. I can feed into that and start refining that system over and over to make sure it's answering the questions that I typically get, and it's answering it correctly. And if not, then I have to keep adding in better and more specific information.
Yeah, so for everybody else, GPT is a term that's specific to OpenAI, correct?
Correct.
And so, Gemini is not a GPT or Llama is not a GPT. So I think you mean you created a custom GPT,
yes,
which you can do in OpenAI's, ChatGPT Plus, right?
Yes.
And
yes.
And so that is available for everybody. It's not expensive. Do you remember what it costs?
It's automated now.
Because the open access
ChatGPT,
GPT, you can't create a custom GPT.
No,
Yeah.
it has to be a paid version.
And so it's really kind of accessible to folks. I don't. It might be like $10 bucks a month.
$20 a month.
It might be $10 bucks a month, something like that. Yeah.
Nominal, enough that
Yeah.
it's on a credit card, and I don't know what it is.
Okay, so it's along with your 3 Netflix.
It's like a
stuff, yeah. Now that's a great idea. I think it's a very accessible, pragmatic idea, and I wonder if it would work across a service. So it's not just you; it's actually your colleagues as well, leveraging a joint custom GPT, because now you have more throughput. But I don't know what the license is for the. Not that I share my account with everybody in my lab. Nobody heard me say that.
So can I also add to that a little bit? So there is this concept of a narrative medicine where we can build a digital twin. So what you did is similar to that idea. We can build a digital twin of our client, and we can, using the AI, we can ask the AI to explain, okay, if I do this, would that work? Based on their past behavior, based on their past medical history, based on their data in our EHR, that can be done. One of the products, I'm not affiliated with Microsoft or anything, but I happen to get a demo, the Dragon Copilot, if you've heard about that allows you to connect basically all those medical information into this profile of a person, and then you can ask the AI behind it to tell you, okay, do you know which medication or which assistive technology that this person used that have an adverse effect, and what happened back then? So you can also prep yourself by asking the AI, and the AI will pull the information from you in a very efficient way.
Sort of on the flip side of that, you can use AI or custom GPTs to create a twin of the medical system and how a patient can use that. So a patient can use this custom GPT to ask, hey, I have this disability, I'm in this age range, what waivers apply to me in my state, and things like that. It's very similar to that twin you were talking about, just on the opposite side.
I want to come back to the therapists and the question about, okay, what could be the added value and how to deal and how to make it as efficient as possible. And coming back then to the keywords of the title, complex rehab, complex movement disorders. When assessment, what's important in assessment, for example, that's evaluation, prediction, discrimination. So when it comes to that, when it comes to indeed complex movement disorders, it can be really helpful because there you can give that added value to therapists to make sure you have a right discrimination, you have a better reliable evaluation, and you can predict. And from that point of view, it's a huge opportunity to use that AI because you need the right discrimination to have the right therapy, to have the right medication, to have the right tool. So from that point of view, yes, it is really added value in the right way to use.
I'll just add my 2 cents. There's a growing number of patients that need to get served, but there's a reducing number of clinicians. And especially when you think about a specialist group like this, you have to think, you can't work harder, right? Because you have to sleep at night. So how do you work smarter? And I think what AI enables, at least to me, is you'll never be able to outsource your thinking. Like that moment where you go to a patient, you have to analyze them and think about, okay, what will help them the most effectively? Like that's what a human always should do. Sure, could you get an assistant in there and say, hey, is there other research on this? But at the end of the day, you're making the decision. To me, that's the top of the license. That's the top of where your time should be spent. Anything else that's administrative, obviously I'm biased towards documentation. I think that's a painful process. But even in terms of responding to patients or thinking through different, I don't know, for me, it's like go leave a meeting, and then I have all my notes written down on a scratch pad. And then I have to go to the next meeting. Right now I talk in a ChatGPT, and I say, this is the meeting I was in, please summarize. And I used to have to do that at night or on the weekend when I'd have time to sit down and think about how to write it. And I don't have to do that anymore. So to me, it's not you're able to get more done at a more effective rate, and we need to make clinicians more productive, frankly, because a lot of times we're getting just spent on, I'd say, documentation and administrative processes that we just need to figure out how to get rid of wherever we can.
Yeah, that reminds me, some of my clinician friend told me that, well, by the end of the day, we are very tired. So if an email comes from our client, we usually respond it very, very harshly, right? Just one line, and because we just want to end the day. But that one line, if you push that to an AI, can become a very, very nice and very, very soft, very, very empathetic message, which is very, very nice to read. So that's I think, a practical way to use it as well.
Thank you so much. Thank you so much. I'd like to, as we start to wrap up, thank our panelists again, David, Elegast, Stephen, Andy, and Cass. Thank you very much. Thank you very much for putting up with my motion sickness slide presentation.